Hi, I'm Monica Ryan for SLU-TV, and today I have with me Dr. Eric Swartz, a professor and chair of the Department of Kinesiology at the University of New Hampshire. Welcome to SLU.
Thank you.
So when were you approached about speaking at the Athletic Trainers Speaking Series?
Several months ago, a great student in your program reached out to me with an invitation. Professor Breitbach was copied on that, who I know I've worked with a little bit before on a committee with the NATA, and I'm already aware of the great program that they have here, so that was a no-brainer for me. I was excited to be invited, and and also excited about learning more about what they do with the athletic training program here, and with this event this evening with the recognition ceremony, and was really honored to be invited. Yeah.
What got you interested in athletic training?
So like a lot of athletic training students, they were athletes and they got injured, and they interacted with a physical therapist or an athletic trainer, and that's what piqued their interest. And so that was the same with me. I played high school, soccer. I played soccer most of my life, and in high school, I then broke my ankle, and even though I went on to play in college for a few years, it was that experience in breaking my ankle playing soccer in high school where I had a physical therapist, and then going to college. Didn't at that time have a major in athletic training, so I was taking courses wanting to become a physical therapist, but also spending time in the athletic training room, and discovered that athletic training was kind of a cool thing because I could stay in touch with the athletics and actually be there on the sidelines and provide care to athletes.
I understand that you work a lot with head injuries, so what got you started specifically focusing on that?
So as an athletic trainer, once I began to practice as an athletic trainer, one of the things that actually concerned me the most about if I had to treat an athlete with a serious head or neck injury, particularly if they were playing football, was how do I manage that the safest way possible? And obviously in football they wear all this protective equipment. And so that protective equipment they wear to help prevent injury, but then once there's a serious injury like a head or neck injury, well, now that equipment is a barrier to their airway and chest in particular. So if it's a really serious situation, you have to access their airway or their chest, now you have to get through that barrier. So as an athletic trainer, a young athletic trainer, I was really concerned with how am I going to do that safely without making the situation worse. So I just decided to do research in that area and focus on it as much as possible. And so head injuries and neck injuries in football share a common mechanism. It's head first contact or putting the head down when you're going into a tackle. And so for the past 15, 16 years, that's what I've been studying.
I understand that you do some preventative work with teams around the area. Could you tell us a little bit about what you exactly do?
Sure. Well, along the lines of the common mechanism of injury that I was describing with head and neck injury, particularly in football, is that when a player goes into a tackling situation or goes into contact and they put their head down, they put themselves at risk. So maybe it's a helmet-to-helmet hit with somebody else, or they hit another player and it places forces on their spine, and then it results in an injury on their spine. Well, how can we prevent that mechanism? How can we help prevent players from going into contact like that with that behavior of putting the head down? So that's what I've been working on. It's an intervention to try and correct that head down contact behavior.
Have you seen some success with that method?
Yeah, we started studying it on the collegiate population. So at the University of New Hampshire, we had a small study with just the football team at UNH for 2 years. And we had half of our research subjects randomized to an intervention group, and then the other half randomized to a control group. And the intervention group underwent drills where they would do tackling and blocking skills, but without a helmet on. And so what that did was that actually made them more protective of their head. So without a helmet on, they would go into contact, and they're just more, you're reflexively more prone to want to keep your head out of the way. I played rugby, so that's where I kind of got that inspiration, because I wouldn't lead with my head when I go into a tackling
Right.
situation in rugby. So in that study, we found in the first year that the intervention group decreased in the number of head impacts that they sustained in each exposure as the season went on. We've studied the high school level as well, and we're still reducing and analyzing that data, but that's a larger study across 5 schools. And so that's the kind of the systematic approach that we're taking to try and scale up in the number of subjects across different programs, as well as in different age and experience levels. In other words, we next want to study the youth level.
Congratulations on receiving a $500,000 grant. What are your plans with that money?
Well, it's mostly spent already because we use that to fund the high school level study.
Okay.
And so that was 2 years ago to support everything that was involved in conducting a data collection during an entire football season across 5 different teams in the area. So we would not have been able to do that without that funding. That allowed us to hire a postdoc, a full-time postdoctoral research associate. We placed athletic trainers that served as research assistants at each of those sites, and they were there on a daily basis. That money allowed us to buy head impact accelerometers for all the subjects that were in the study, because that's how we were demonstrating the cause and effect relationship, was by recording head impacts. And those are not cheap. Those are $10,000 per system. All the subjects got new helmets because you want to standardize across everybody. So it really starts to add up. So that grant was critical for us to be able to carry out a study of that size.
Well, thank you so much, and good luck with the rest of your research. Thanks for coming to SLU.
All right, thanks for having me.
Once again, I'm Monica Ryan for SLU-TV.